Have you ever wondered if memory loss is just a normal part of aging, or could it be something much more serious? Millions of families struggle to tell the difference between dementia and Alzheimer's disease. In this video, I'll explain the key differences, the warning signs you should never ignore, the available treatments, and when it's time to seek medical attention. This information could make a life-changing difference for you or someone you love. Dementia versus Alzheimer's disease. What's the difference? Many people use the terms dementia and Alzheimer's disease interchangeably, but they're actually not the same thing. Think of it this way: dementia is an umbrella term, while Alzheimer's disease is one specific type of dementia. Imagine dementia as a large tree. Alzheimer's disease is the biggest branch on that tree, accounting for approximately 60.80% of dementia cases. There are also other types, including vascular dementia, Lewy body dementia, and frontotemporal dementia. In other words, everyone with Alzheimer's has dementia, but not everyone with dementia has Alzheimer's disease. Understanding this difference is important because different forms of dementia may have different causes, treatments, and progression. Common symptoms: they share both Alzheimer's disease and other forms of dementia can cause memory loss that affects everyday life, difficulty finding the right words, confusion about time or place, poor judgment and decision-making, trouble completing familiar tasks, repeating questions over and over, losing or misplacing everyday items, personality or mood changes, withdrawal from family and friends, difficulty following conversations. These symptoms often become more noticeable over time rather than appearing suddenly. Symptoms, more common in Alzheimer's disease. Although symptoms overlap, Alzheimer's often begins with short-term memory loss, forgetting recent conversations, repeating the same stories, asking the same questions repeatedly, difficulty learning new information. As the disease progresses, individuals may experience confusion about loved ones, wandering from home, difficulty dressing or bathing independently, trouble swallowing in later stages, loss of speech, needing around-the-clock care. Symptoms, more common in other types of dementia. Depending on the cause, other dementias may present differently. For example, vascular dementia often develops after strokes or reduced blood flow to the brain. Difficulty with planning, organization, and concentration may appear before significant memory loss. Lewy body dementia, visual hallucinations, tremors or Parkinson-like movement problems, fluctuating alertness, acting out dreams during sleep, frontotemporal dementia, personality changes, loss of social awareness, poor impulse control, inappropriate behavior, language difficulties. Who is at higher risk? Several factors increase the risk of developing dementia or Alzheimer's disease: age over 65, family history, high blood pressure, diabetes, high cholesterol, smoking, obesity, physical inactivity, previous strokes, traumatic brain injuries, excessive alcohol use. While age is the greatest risk factor, dementia is not considered a normal part of aging. How are they diagnosed? Doctors use several tools to determine the cause of memory problems, including a detailed medical history, physical and neurological examination, memory and thinking tests, blood tests to rule out vitamin deficiencies or thyroid problems, brain imaging such as MRI or CT scans, sometimes PET scans or spinal fluid testing to help identify Alzheimer's disease. Early diagnosis is important because some causes of memory loss are treatable or even reversible. Is there a cure for dementia or Alzheimer's? Although there is currently no cure for most forms of dementia, treatment can help improve symptoms and quality of life. Doctors may prescribe medications such as cholinesterase inhibitors, such as donepezil, rivastigmine, or galantamine, to help with memory and thinking in some people with Alzheimer's disease. Memantine for moderate to severe Alzheimer's disease, sometimes combined with a cholinesterase inhibitor. In selected patients with early Alzheimer's disease, newer anti-amyloid therapies may be considered after careful evaluation by a specialist. Treatment depends on the specific diagnosis, overall health, and whether the potential benefits outweigh the risks. There are lifestyle changes that may help. Research suggests that healthy lifestyle habits may help support brain health. Regular exercise, a heart-healthy diet, such as the Mediterranean diet, controlling blood pressure, diabetes, and cholesterol, good sleep habits, staying socially active, keeping the mind engaged through reading, puzzles, or learning new skills, avoiding smoking and limiting alcohol. These steps may not prevent every case, but they can contribute to better overall brain health. When should you see a doctor? If you or someone you love is experiencing persistent memory problems that interfere with daily life, don't ignore them. Seek medical evaluation if someone frequently gets lost in familiar places, repeats the same questions many times, has trouble managing medications or finances, shows sudden personality or behavior changes, becomes confused while driving, has rapid changes in memory or thinking. The earlier the evaluation, the more treatment options and support services may be available. The information presented in this video is intended for educational and informational purposes only and should not be considered medical advice. It is not a substitute for evaluation, diagnosis, or treatment by a qualified healthcare professional. If you or someone you know is experiencing memory loss, confusion, changes in thinking, or other concerning symptoms, consult a healthcare provider promptly. Never delay seeking professional medical care because of something you heard in this video. In the event of sudden confusion, weakness, difficulty speaking, or other stroke-like symptoms, call emergency services immediately. Memory loss can be frightening, but knowledge is one of the most powerful tools we have. Understanding the difference between dementia and Alzheimer's disease can help you recognize the warning signs early and encourage someone you love to seek medical care before symptoms become more severe. If you found this video helpful, please subscribe, like, follow, and share it with your family and friends. Your support helps us continue providing reliable, easy-to-understand medical information that can make a real difference in people's lives. Thank you for watching, and I'll see you in the next video. Stay healthy, stay informed, and take care of one another.